there's a fair amount of congenital deafness, and as opposed to America, where there are deaf schools that teach children communication, and now with the cochlear implant now is actually emptying deaf schools in America because of the benefit that cochlear implants provide for children when they're very early age, whereas in Malawi and most of Africa, actually, there's no such thing as cochlear implants, or they're not done because of their expense. And so a child born deaf in Malawi and most of Africa is pretty much just they learn gestures and get along the best they can, usually unemployable, usually beggars, and so on. So that's another whole great need, along with many other needs for sub-Saharan Africa. But the other issue with Malawi is about 40% of the population has HIV/AIDS, and now the government, it is becoming under control because the government now does supply medication, and the people are very good in taking their medication, and it is getting it under control. But in the heyday, prior to the development of drugs for AIDS treatment, there estimated to be 2 million AIDS orphans. When we operate, the first question you ask is, do you have AIDS, and are you taking medication? Because, of course, AIDS is transmissible through if you stick yourself while you're operating on someone with AIDS, you're at risk for developing AIDS, so we're real careful about that. The last trip that we made now was about this last November, where I again went with the team from Michigan State. And to give you an idea of what we do, we did 34 major operations in 6 days. So it's different than operating here. There were 2 rooms, so one was a smaller room where we did ear surgery, and we did 2 a day of ear cases. And then the other room, they actually put 2 operating rooms side by side, which you would never do here, of course, because of contamination and so on. The surgical consent that is written, it says, I give permission to the doctor on duty to do any operation on my body. That's the surgical consent. So, as other words, it's sort of carte blanche. I'm in your hands, doctor, take care of me. And which is a wonderful trust, but I think probably wouldn't fly here with the medical legal system. Well, we did 12 ear cases. There's a lot of goiter in Malawi. You know, the goiter's the thyroid, and that is due to the lack of iodine in the diet. In America, all salt is iodinated. If you look at any salt, it always says iodinated salt, and just that little bit of iodine prevents goiter. But it's almost for some reason, more women get goiters than men, and I'm not sure the reason for that. The head and neck team that was with us, they did 4 or 5 goiters a day. So it was a lot of head and neck, and as well as some cancers and so on. And I was joking with my wife that how much further Africa was away now than it was 50 years ago, because it's a long way, and it's really tough. You know, it's a 11-hour time difference, so you arrive over there and immediately got to go to work. So it's pretty taxing, but very rewarding. And there's a lot of good to be done, and you know, a little bit goes a long way in terms of support. There are mission organizations that I support over there through our church, and so I'm encouraging some of my colleagues and friends, and a lot of people say, "Oh, I'd love to do that," but then getting them to do it is a really hard thing. Because it's a long way and it's a hard trip, but it's very rewarding, and we intend to go back on a yearly basis.